Aloha, everyone, and thank you so much for tuning in to another week of Trauma Recovery University. I am your host, Athena Moberg, and with us in the green room, of course, is your incredible co-host and my esteemed colleague, Bobby Parrish. Thank you, first of all, to all of you who show up early and hang out and communicate with one another and share your questions and answers and support and just overall awesomeness with one another on the hashtag No More Shame using the Twitter app. So thank you, thank you, thank you. I'm Athena Moberg. I'm an adult survivor of childhood sexual abuse and exploitation. And if you are here for weekly live Q&A, you are in the right place. Bobby Parrish and myself show up every single week to support the global community of adult survivors of child abuse, specifically childhood sexual abuse. And we answer your questions that you send us on a topic every week. And this is one of 3 Twitter chats. We have 3 Twitter chats a week. This one has a video component and the other 2 do not. The first Twitter chat of the week for the survivor community is hashtag CSAQT, which stands for Child Sexual Abuse Question Time. And that's geared more towards our UK audience since it is very rapidly growing. And that is at 10 a.m. Pacific, 1 p.m. Eastern. And then the second one is tonight, hashtag No More Shame. Send your questions. We will answer them. And then our third Twitter chat is the original sex abuse chat on Tuesday, 6 p.m. Pacific, 9 p.m. Eastern, with our very own Bobby Parrish and Rachel Thompson. So welcome, welcome, welcome. If you are listening on a podcast platform on iTunes, Stitcher, Spreaker, SoundCloud, or iHeartRadio, we love you guys. We appreciate you. And we're grateful for you. And we also want to remind you this is a video broadcast. So please head on over to our Roku TV channel and search for Trauma Recovery University, or to our YouTube channel, also searching for Trauma Recovery University, or youtube.com/Trauma Recovery University TV. So as always, every single week, we offer you, just for free, just for being awesome, just for being an awesome survivor, we offer you a complimentary one-page downloadable resource that matches up with the topic of the evening that you can get easily sent to your email box conveniently by going to one of our websites, either traumarecoveryuniversity.com or nomoreshameproject.com. And click on the tab that says downloadables. You'll be given immediate access after inserting your email address to not only tonight's one-page downloadable resource, but to our entire library of downloadable one-page resources that are crafted and designed specifically for you, the survivor of childhood abuse, childhood sexual abuse, trafficking, exploitation, incest, any form of child abuse. And Bobby Parrish and myself craft that one-page downloadable resource for you every single week, and it's available to you for free just because you're awesome. And we will be going through that one-page downloadable resource tonight in its entirety. And if you are tuning in on a replay and you're not here live to hang out with all of us and get your questions answered, just as a convenience to you, you can go down right before the comments in the description section of this video, and you can click the number and it will fast forward through everyone's questions and only give you the one-page downloadable content and us going over it in video format for you, if that is something that you prefer and you don't want to hang out and like ask questions and interact because you're not here live. So we get it. But we do provide this weekly broadcast. We sometimes get emails and questions like, why do you guys talk so much at the beginning of your YouTube videos? Why can't you just get to the point? Come on, come on, come on, get to the point. Why don't you just get to the point? Well, the reason is these are live hangouts. These are live Q&A sessions. And if you're tuning in on a replay and you're not a member of this community and you're just like, come on, come on, come on already, I'm trying to heal, then just, if that's you, it's cool. Welcome. Go on down in the description section to the very bottom, click on the number, and you'll fast forward through all of our talking, and you'll just get to the content only. So you are welcome here, and we love you. But, you know, you're welcome to join us at 6 p.m. Pacific, 9 p.m. Eastern, any single Monday and get your questions answered. Each week it's a different topic. This week's topic is common misdiagnoses for adult survivors of childhood sexual abuse. So, common misdiagnosis. One would think, gosh, is a misdiagnosis that common? I mean, do people really get misdiagnosed that often that there would be an entire video dedicated to getting misdiagnosed? Well, the answer is yes, and the reasons are in the one page, and we're going to unpack all of that for you. Sometimes practitioners are not trauma informed. Sometimes practitioners, I mean, I went to the doctor a week or so ago, and I had a doctor that was not trauma informed, and he was really, really, really not kind. In fact, he told me that, he said, I don't really want to hear any of your medical history, okay? I don't need to know any of your medical history. Would you please not talk about it? Thank you. That's what he said to me. And so I won't be going back to that doctor, because if I'm going to stand naked with a piece of paper wrapped around me and have someone touching my body and doing things to me, I would like them to know that I live with PTSD and that I tend to dissociate when I am not dressed. And I would like the doctor to actually give a shit. So he's not trauma informed. He doesn't get my business. I'm going to pay another doctor to help me that is trauma informed. So doctors sometimes that are not trauma informed tend to maybe come to a snap decision on a misdiagnosis or on a diagnosis because they're under a time constraint because of insurance companies and everything else. There's all kinds of different reasons how you could get a misdiagnosis. So we're going to unpack this loaded topic. I'm sure the conversation is lively. It is kind of controversial. I do want to preemptively say that we are not here to bash doctors, even though I just bashed that one doctor because he was kind of an a-hole. But we're not here to bash doctors in general. And we're not here as medical professionals here to tell you about your diagnosis or tell you that you're not diagnosed with something or anything. We are your peers, and this is a peer-to-peer environment, and we encourage you to seek out a health care professional. So I'm going to go ahead and step down off my soapbox now and turn this over to my lovely partner, Bobby Parrish, and I'll take over the Twitter stream for you if you would like. Miss Bobby, take it away.
Yes, you bet. So if you're seeing us looking down at our phones, it's not because we're bored and chatting with people. It's because we're monitoring the Twitter stream and responding to people's questions. So let me just hashtag that and send that out, and it's gone. It's so nice to see everybody tonight. If you're here live, it's great to greet you and see you, those of you who are regular members of our Twitter community. And if this is the first time that you're here with us live tonight, I want to issue a special welcome. Give us a shout out on the Twitter stream if you'd like, if this is your first Twitter chat Monday night in video interactive with us, and we will give you a special hello. I want to issue a trigger warning for tonight's chat. This is a discussion of childhood abuse, and specifically childhood sexual abuse. So if you feel triggered, it is more than okay just to shut things down and walk away. If you're watching us live, the video will be up on YouTube later tonight. If you're watching a replay, they'll always be here. We're not planning on going anywhere, and if we go somewhere, not planning on taking the videos with us. So feel free to come back later. Maybe this isn't the time right now in your recovery to watch this particular video. Maybe another video would be better suited to you. I think we have more than 100 to 125 hours of content on YouTube and Roku TV. So feel free to find something that is not triggering for you. We absolutely do not want you to be triggered in watching tonight's broadcast. We want you to feel free to absorb the information, ask questions, see what fits for you, what your takeaway might be. As we said, not every topic everyone's ready to hear, or everyone's at that part in their recovery journey where it's information they need. So we're here. The video is going to go up on YouTube and Roku TV, and when it is time for you to watch this, just come on back. If you are in crisis tonight, or you get triggered, we want to encourage you to reach out to some resources. If you are in the US or Canada, you can reach out to RAIN, which is the Rape, Abuse, Incest National Network. And they are available at 1-800-656-HOPE, HOPE. Now, we did get an email this week from someone saying that RAIN on their hotline would not help them because they were from Canada. That's the first time that I've heard of that. So I'm going to do some checking into that. But to the best of my knowledge, on RAIN's site, it says that they are available to US and Canada. They do have a crisis chat feature on their website at rainn.org. So you can use that as well if you are a US or Canadian resident.
Hey, Bonnie. Stuart works with the Gatehouse. Is that something that's comparable to RAIN? I was assuming, I think he works with sexual abuse survivors at the Gatehouse. Doesn't he do?
I think it's more. I don't know if they offer a hotline, but I think that's more of a local resource than it is a national resource.
Oh, I meant
let's check into that.
Yeah, like I don't even know what area of Canada they're in, or or if they have like a phone, or like they offer phone support.
Yeah.
I'm sure they have a phone. I didn't mean it that way. Sorry, I didn't mean to interrupt.
They're up there communicating by smoke signals and carrier pigeons.
Yes, of course. That's what they do in Canada. That's what I hear, eh?
Oy vey. Okay. So if you are in the UK, you can reach out to the Samaritans, and their number is 116123. And I was told this morning on our first chat of the week, that you can also reach out to them via text. And I did not know that, but the number that was given to me was 0775 909090. I need to double check that, but that was the number that was given to me, that you can reach out to them via text. I do know for certain that you can reach out to them via email, and email them at jo@samaritans.org. If you are in Australia, your national hotline number is 131114. I think these numbers don't stick in my head because they're not formatted in the way that I'm used to phone numbers being formatted in. So
like 3-3-3-4.
Yeah. So I have them on a sticky here on my phone. And I want to reiterate what Athena already said. We are not physicians. Although I am a therapist, I am no longer operating as a therapist. I do not any longer do diagnosing. So we are not here tonight to tell you whether or not you have been diagnosed properly. We can't offer you individual advice on your diagnosis or alternative diagnoses. So what we're here to offer tonight is education, okay, and knowledge. Knowledge is power. If you have the information that you need, then you can tackle the issue for yourself. It can be a really troubling issue for a lot of survivors. I wish I could say that I had seen less of this than I do see, but unfortunately, I see it more commonly than I would like. Survivors being misdiagnosed, either because the person diagnosing them is not trauma informed and they don't take a complete history, or they don't understand what one's childhood history could have an impact on their current mental health, or they have a personal bias, or they're working too swiftly. And for one reason or another, they want to just stamp that label on you and get you out of the office. There are many reasons, but it isn't a good thing. Okay, we talked about that in chat this morning. One of the reasons it's not a good thing is because there are treatments, and there are especially medications geared towards specific mental health diagnoses. So if you are misdiagnosed, not only could you be given the wrong medication, but you could be provided with treatment that is not helpful, that could not just hinder your recovery, but could actually prolong your recovery. And we do not want that for you. Furthermore, there are diagnoses, especially borderline personality disorder, that is very stigmatized within the mental health community. And for some of my clients who have received diagnoses of borderline personality disorder, rather than complex post-traumatic stress disorder, they then end up getting treated poorly within the mental health community, because some see someone as borderline personality as a problem client. They see them as very needy, they see them as very time intensive, and they see them as never getting better. Now that kind of makes sense if the diagnosis, not the neediness, oh my goodness, sorry, the not getting better. Personality disorders can be managed, the symptoms, we can learn how to handle them better, but the nature of a personality disorder is that it's something that's ingrained in your personality, and therefore there is no quote-unquote cure. And so when someone sometimes has a borderline personality disorder, they simply aren't provided with very much effective treatment because they aren't seen as someone who can recover. But when you have a history of childhood abuse and trauma, it is very rarely a proper diagnosis of borderline personality disorder. It's more likely a diagnosis of complex PTSD. Richard Grannon, the Spartan Life Coach, pop over to YouTube and look at some of his videos. He has some excellent videos on complex post-traumatic stress disorder and the difference between BPD, borderline personality disorder, and complex PTSD. I believe it's Pete Walker who has the excellent book out now about complex post-traumatic stress disorder. So if you have been diagnosed with borderline personality disorder and you are a survivor of childhood trauma, look for those resources. Okay, I want you to do that because it could very well make a big difference in your recovery and your recovery planning. So as we unpack all of this tonight, we're going to talk about why people get misdiagnosed. We're going to talk about the most common misdiagnoses, and then we're going to talk about what do you do if you feel like you've received a diagnosis that is wrong or off slightly or whatever it is. It just is not a good fit. But I want to make sure that everyone hears Athena and I when we say that you might not need a diagnosis. Okay, diagnosis is something that came from the physical body, the practice of medicine on the physical body. Okay, you break your leg, you have diabetes, etc. And it was moved over into the mental health world where it's not the same process. You're talking about something that is generally very objective, measurable. I can see it on an MRI, I see it in a blood test. And now you're moving to something that is so much more subjective. So I have seen clients never get diagnosed, and they do fine. They recover just fine. If they get into the world of seeking treatment with an insurance company, they're going to have a diagnosis because the insurance company mandates those. But I want to make sure that you clearly hear us say that a diagnosis isn't something you must have. You need to understand what you're dealing with. You need to understand where it came from. But that's not the same as being slapped with a label. So don't misunderstand us trying to educate on this topic as an endorsement or an insistence that all of you run right out and get a diagnosis, because that's not what we're saying.
Yeah.
So
I got some questions here.
okay, hit me.
Beth, thank you so much, Beth. Beth is awesome. Beth says the Gatehouse is in Toronto. And she's
Okay.
back. And she's back this week. We're happy you're back, Beth. We love it when you're here, and we're proud of you for being here also. The questions I have are, Simi says she didn't even know she was abused when she was diagnosed at 8 years old with ADHD or hyperactivity. And Matt says, I often wonder if I had sought help earlier and been diagnosed where I would be now. Would I have been ready to accept it and work to heal? And Kalisha says, Inundated Insiders. Hi, Alexis. I was misdiagnosed years before I found a trauma therapist.
Yes.
And Kalisha says, the first time I saw a doctor was for a sprained wrist at 12 years old. I had issues with my sight and with learning, and my parents didn't care.
Ouch.
I'm sorry, Kalisha.
That's awful.
And Laura is visiting, but she's just going to lay low for the night because this topic is very triggering. And yeah, so I think the overall feeling that that is kind of going on, guys, is that we sometimes feel that there is a diagnosis that's sort of snapped to, like a snap decision to find a label to put on it. Like, if you can name the beast, you can tame the beast, which I subscribe to that sometimes, but not in this case. Like, you have to be able to name it properly if you're going to tame it. Bobby, what are your thoughts on that? Because this is such a painful thing for survivors to deal with, being overlooked. And honestly, like I remember telling you when I got back from the doctors, I'm so uncomfortable tonight, you guys. I have some leg pain for some reason. There's low pressure. But the doctor that I saw that was not trauma informed, he was only a dermatologist, but I asked, why can't I keep my clothes on if I'm going to the dermatologist? And the issues I had were on my face, and they said that they wanted to do a full body scan. And so my rights, I know my rights, right? I'm allowed to let them know that when I'm naked, that I live with PTSD due to childhood sexual abuse and exploitation. And being naked is triggering for me. And sometimes I dissociate and I lose time, and I need someone to keep me engaged. I need someone in the room with me to have a conversation with me, to check in with me and see if I'm okay. And he didn't want to hear about any of that. He said, I don't want to hear about any of your medical history. I don't need to know any of your medical history to find anything on your skin. So I don't want to hear it. I don't think I told you that part, Bobby, but that's what he said. I told you I think that he was an a-hole, or his bedside manner would be under the category of insensitive a-hole.
Severely lacking.
Yeah. So, but I mean, as far as Simi, you're diagnosed at 8 years old with hyperactive, and Kalisha, I mean, she couldn't see and she was struggling with learning, and no one even paid attention. Like, what do you attribute that to, Bobby? Like, are these just holes in the system? Are these isolated incidents that aren't a part of a systemic problem? Like, I feel that it's systemic, and I don't think that it's unique to certain individuals, and it's just like, oops, like every now and then it seems systemic to me, and it's just my opinion.
Yeah. I think as a mental health community and a medical community, we seriously fail to take appropriate history. I absolutely adore the ACEs study that's out. Childhood experience. What does the A stand for?
It's adverse childhood experiences.
Adverse childhood experience.
I'm a huge ACEs fan. I scored a perfect 10, overachiever that I am. Go me.
And I think we need to start asking those questions when kids are little. In fact, the first time a parent comes in with a newborn for their first pediatric visit, I think it's appropriate to ask the parent, the questions about the ACEs and get their ACEs score so that you can know what's going on with the parent that is parenting this child. Not to misuse it, not to use it against you, but to help you be able to successfully parent this little tiny thing that's completely dependent upon you. And, you know, Kalisha, she goes in and she has problems with her sight and learning, and it's dismissed. That's wrong. That a trauma history should be taken every time you see a new client, whether that's, I'm not talking about, you know, sit down and, you know, for half an hour, tell me your life story. I'm talking about having those questions that are asked on the ACEs evaluation asked. And it's appropriate to check in with a child. If a child's 12 years old, it's appropriate to check in with them and say, do you feel safe at home? Is there anything going on? We need to do a better job. And we need to do a better job not just in the mental health community, mental health professionals, but we need to do a better job in all fields of medicine. As example, your dermatology appointment. Okay, I'm sorry, but your medical history, your history has a huge impact on you being there, and it is completely insensitive of that doctor to not care. What hurts my heart the most are people who don't have choices when it comes to their medical provider. It's you either see this person or you see no one. And they, you know, could get someone who is totally dismissive of their history, or, you know, is ready to go home for the day, and so just slaps a label on them, hands them a prescription, and out the door they go. I had a psychiatrist one time tell me that they tell me these things. I look back on them now and laugh, but they were traumatic to me at the time. She told me I needed to jump rope at home. I had a child less than a year earlier. I was dealing with postpartum depression, not to mention all of my trauma from my childhood.
And you were supposed to go home and jump some rope. That was your treatment?
Yes, that was my treatment. Oh, she gave me a prescription for Paxil too, which I told her I'd taken in the past and it had never worked. But so I got a useless prescription and a prescription to go home and jump rope. And I'm like,
Paxil and jumping rope were your prescriptions for postpartum.
Yeah, for postpartum depression. Yes. Yeah.
Wow. Okay. Wow.
So, and I would really like to say that I have seen a shift in the mental health community and how they treat people with trauma histories, but I have not. And it breaks my heart because I have so many clients who need a good informed trauma psychiatrist. I have so many clients that need a good trauma informed general physician, and they can't find them. And it's just heartbreaking. I have clients who are suicidal who need to go in the hospital, but the hospital psychiatric wards are not trauma informed. And so sometimes they are even more traumatized by the hospital stay than they are helped. And so, yeah, they're safe. They didn't kill themselves while they're in the hospital. But now when they're out, now we have even more to deal with than we did when they went in. So it's very frustrating. And as you can tell, this is a topic that is near and dear to my heart. I have a huge pet peeve about this one. So I think you're right. It's a systemic-wide issue. We need more trauma-informed care education. And then we need the people who are providing the care to be invested in providing trauma-informed care. Okay, because you can provide education about anything. If they don't use it, it doesn't matter. So I realize this is not going to be a popular opinion among many of my peers. But 2016, I declared to be the year that I would be more of a disruptor of the mental health care system. So here I am saying, we need the education, and then we need people to take the education to heart.
Well,
not just let it go one ear out the other.
I agree. I think we're doing a pretty good job of disrupting the mental health system status quo just by choosing to show up every week and listen to people's hearts and their questions and give them education that we've researched. And sometimes people don't have time to spend all day researching and educating themselves on certain topics, especially as it pertains to mental health. But I mean, that's what we're here doing. And I think it's awesome that we're able to do that. I had a couple of comments that I wanted to share with you on the topic that you were discussing a second ago about on the topic of Paxil being prescribed and jumping rope being prescribed as postpartum for postpartum depression. We have one of our community members, Laura, who we love, said that she went through 6 psychiatrists for a diagnosis, and she was known as troubled.
Yes.
Tell me how this. She's saying this. I'm sure tongue in cheek or angry tongue in cheek. Which I mean, I would be angry as well. In fact, it makes me angry reading it. Tell me how reenacting what I went through with a doll helped me.
Yeah. Yeah. And that's the part, what she mentioned, I've seen this time and time again too. In fact, I experienced it myself. When we stand up for ourselves, sometimes within the mental health system, and we say, no, that doesn't work for me. I don't like the way that you're treating me. And we seek out another psychiatrist. Guess what? Sometimes a label goes with us. I was once fired by a psychiatrist I was working with because I hospitalized myself in a trauma hospital, an incredible trauma center that just literally changed my whole recovery. And he was opposed to it. And so he fired me and labeled me borderline. There you go, both of those things.
Labeled you borderline.
Right, labeled me borderline. Yeah. Yeah. So I found another psychiatrist and I said to her, I don't want you to get the records from my other psychiatrist because I can tell you right now, I'm sure they're very negative. And bless her heart, she said, sure, that's fine. Let's start over. And so I gave her all my history, and she turned out to be someone that I worked with for like 6 years, and she was incredible. She was great. But if we stand up for ourselves within the mental health community and label things as not acceptable, even though we may say it with the most politically correct, kind, courteous language, sometimes we are labeled as the problem if we want to see someone different, or we want to say, no, I don't think what you're recommending is the right thing to do. I would like to do B instead of A that you're recommending. And that makes my blood boil. It's just, yeah, wow. I mean, here we are, our biggest hope for all of you is that you gain enough education and power to be in control of your own recovery and to be able to recognize in yourself what you need to do to get to where you want to be.
Boom. Stephanie Lynn says, I have never met a person with mental illness who wasn't traumatized. The two go hand in hand.
I have to say, I see it so frequently. And I can agree with that in my own personal journey. I was more traumatized by much of the care I got than I was. I had another psychiatrist call me squirrely.
Where is that in medical books?
At the DSM-5, right? She called me squirrely because I did not want to sit down in the cafeteria and give her my medical history.
Huh.
I wanted to do it someplace private.
Well, you have a right to privacy. You have a right to privacy. That's one of your rights.
Yeah, but no, that was not apparently one of my rights in her book.
Oh my goodness gracious. This is so frustrating to even talk about, you guys. Wow.
Yeah, and it's funny now, but Steph is right. When it happens, it's really traumatic. I mean, here you are, I'm already in a psychiatric ward. Okay, so I already feel terrible. And here's someone who wants to slap a label on me, which I'm sure she then goes around and gives to every person there in the psychiatric hospital. So now I have every nurse, every practitioner aware of this, and of course, not all of them are going to give it any weight or credence. But yeah, it's traumatic and it's wrong.
Lindy says mental health in 2016 is a joke. And Tracy says, I feel that I have attachment issues, and I was told no way, so my therapist wouldn't even discuss it or help me work on it. That's a shame, because if anyone knows if they have attachment issues, it would be the person that has the attachment issue. I mean,
yeah.
If you feel that you are struggling with an attachment, with some attachment issues or some sort of an attachment issue, which obviously are developed in childhood,
right,
then who is your therapist to say no you don't, if you know what an attachment issue is and you identify with that? I don't understand. Again, it's just someone that's not trauma informed. Unfortunately, maybe her therapist was not trauma informed, because trauma informed practices empower the client.
Yeah.
I'm sorry, Tracy.
No, thankfully there are people out there who are trauma informed, who are helpful. I now have a psychiatrist here in Dallas that I've worked with for 9 years now, who is phenomenal. But for every good psychiatrist that I've worked with, there have probably been another 4 or 5 that were not. So it's hard, but there are people out there. And when you're feeling badly, it's really hard to have someone say to you something negative, and then it's really hard for you to say, okay, I'm going to start over again. I have to find another psychiatrist. I have to find a different therapist, and go out and go through the work one more time of combing through your insurance or combing through the directory one more time to try and find someone who is a fit for you. And I wish it were easier. I really do. So do we want to take a look at the one page?
Yeah. Real quick, Katie just says that education is the single greatest weapon, and I would absolutely tend to agree with that, because when we're educated about what's going on with our own bodies, you guys, it's so empowering, and
yep.
we're able to heal at a more rapid pace when we know what it is we're working towards. When we know what it is we're working with and working towards, we can heal at a more rapid pace, and we can, the stigma begins to fall off and not be so strong. I think, and I know this has been said a lot, but it bears repeating, one of the biggest problems in the mental health world is the stigma attached to getting help and getting diagnosed so that you can receive proper help. And I don't know what else we can possibly do to reduce the stigma other than what it is that we're already doing, which is raising awareness, educating people, and helping them recover. I mean, obviously there's a prevention prong in there,
right,
at a younger age for childhood sexual abuse that we're working towards, but I don't know what else we could possibly do differently. Bobby, what are your thoughts on that before we transition?
I think, again, the key is education, and the key is empowerment as well, so that you not only have the information, but you feel you have the power to do something with it. And then, gee, shocker for me to recommend this, community. Okay, because there are going to be people you're going to run into who are not going to appreciate the fact that you are educated and empowered. And you might run into a few professionals who don't like that, and that's when you're going to need the support of community to let you know it's okay, we'll be here, we'll back you up as you find someone else. Or if this is your only choice, we'll advocate for you if this is not going well. And we can be advocates for each other. You know, if I'm a little farther down on the journey than, you know, Simon, who is just starting out, and he needs to find a psychiatrist, I can help advocate for him, and I can help him learn to advocate for himself. So I think there's so much to be said for education, empowerment, and community. And that's my personal solution. Besides us just chucking the mental health system out and starting over with something else. Redesigning it, you know, but like that's going to happen. So there you go.
Kate says, even some of my therapy as a child was traumatizing. Why was I shown pictures of full naked men? And I would have to ask the same question. Like, Bobby, you did therapy with children for quite some time. I took a family member of mine when they were sexually abused by another child. I took a family member to receive help and receive counseling, and but there was never any pictures of nudity that went on during that care. It was mostly having this particular family member draw pictures and explain what it was that happened, and just talk about how they were feeling, and did they feel afraid, and who could they talk to, and just educating this person and making sure that, you know, they could reduce the trauma, not re-traumatize. What is the purpose of showing a child pictures of naked men? Have you heard of that before?
I've never heard of that, and I can't even begin to see that as being valuable to a child. I can't begin to see it as doing anything other than re-traumatizing them. So I do not know what the basis for that would be. And I can't see any situation whereas I would think, where I could condone that with a child. I can't even condone that with an adult woman going into therapy and someone showing her pictures of a naked man. No, men shouldn't go into therapy and be shown pictures of naked women to talk about their abuse. No, sorry, I can't even begin to imagine why that would be anything other than just heart-wrenching, traumatizing.
I don't understand it. It makes me really angry just to even think about it. It makes me so angry. Allie's here. Hi,
Allie. Hi,
Allie. And Stephanie says, the abuse caused real brain damage. I dealt with this too. Yeah, you guys, we've mentioned this in previous broadcasts. We're going to be transitioning over to the one page here in a moment. But we've mentioned in previous broadcasts about how if your childhood sexual abuse happened over a long period of time, like if it was not a one-off instance of abuse, it does not make your abuse any less traumatizing. It's very valid. That is not what we're saying. But if your brain was soaking in a toxic soup of adrenaline and cortisol, and you were constantly hypervigilant because of ongoing child abuse for years and years and years because your environment was toxic, then there are chances that you have some permanent brain damage. It does damage your brain permanently. You can make new roads and you can create healthier habits, but you're building upon what it is that you have left. You're not restoring what it was that was taken. Like,
right.
So we want to acknowledge how real that is, and just let you know that you're not alone. Like, those are things that we live with also, and we're finding ways to rebuild our lives, and we're glad you're here doing that with us.
Yes, and Athena and I were talking about just before we went on air how, both of our executive functioning has taken a bit of a hit here recently, and that, it may very well be that might be something that we're going to struggle with for a long time, but that's not our fault. And we did do a video, I believe it's called Trauma and the Brain, and it should be up on our YouTube channel and on Roku TV, where we went through and we listed the different parts of the brain that are damaged by abuse and the type of damage that's done and how to help and cope with that. So have a peek at that one.
We have so many more people that are tweeting in, and it's moving kind of fast, but I'm thinking that we should transition over to our one page and go through it just straight through.
You bet. You bet. Oops. Wrong screen. Okay, there we go. Okay, I'm gonna make this just a little bit bigger. Lots of bullet points this week. I'm experimenting with whether or not bullet points are more helpful than just paragraphs. Okay, so let's talk about common misdiagnoses amongst adult survivors of childhood abuse. A problem often seen among adult survivors of childhood abuse is a misdiagnosis by mental health professionals. When survivors are given the wrong mental health diagnosis, they can receive inappropriate treatment or even negative judgment due to stigma attached to specific diagnoses. Some factors leading to misdiagnoses. We talked about this first one a lot in chat this morning. A diagnosing professional moving to diagnose too swiftly without enough time to observe and interact with clients. This is a frustration of mine when I have a client who goes to see someone and that person sees them for 30 minutes and hands them a diagnosis and sends them out the door. That's just way too short of a period of time to properly diagnose someone. This morning in chat, Brenda was talking about diagnoses such as rule out and provisional. And there are those options. One of the problems right now with the mental health system is that if you have insurance, the billing that is sent to your insurance must have a diagnosis on it. It just must. That's the way the system works. And so professionals feel like they are pressured to make a quick diagnosis in order to receive the insurance support. And the rule out diagnoses and provisional diagnoses are not used often enough. And so when you are given a diagnosis after only 30 minutes of someone seeing you, I would not put a whole lot of weight in that diagnosis. The second one is, I just briefly talked about this, an insurance company's insistence on a speedy time frame for diagnosing or refusing to treat or acknowledge certain diagnoses. I have thankfully seen the latter wane a bit, but generally insurance companies are not very happy about treating personality disorders because they see them as untreatable and a waste of money. And often it's the insurance company that is insisting that a diagnosis may be treated, must be provided quickly. Thankfully, due to mental illness insurance parity laws, okay, when I was going through the worst of my recovery, my insurance only covered like 12 sessions of therapy a year. Well, gosh, that got me through the first 2 months of the year, and then I was out of insurance. Or if I went to go do inpatient hospital, I only had $10,000 worth of benefits. Well, $10,000 in a psychiatric hospital might be about 10 days. These days it might be even less. But now, thank goodness, the laws have been changed. And the law is that anything that is available for a quote-unquote physical diagnosis also must be provided for a mental health diagnosis. So there no longer are those, you only get 10 visits. But sometimes there are still ways that the insurance companies work around that. For example, they rate providers that are using their insurance plans, and they rate some more highly because they are able to treat and resolve an issue within 12 weeks. So it's still a challenging field, and it is still a problematic field, and it still encourages quick diagnoses, and sometimes ends up with clients being denied treatment or given the wrong treatment because of that diagnosis. And then the next one is diagnosing professionals not being trauma informed. We've talked about that one. Clients not feeling safe to fully disclose their history of abuse and or the after effects of their abuse. And this one is huge. I think it was Simi who mentioned that she was diagnosed with ADHD when she was 8, but she didn't have memories of her childhood abuse until she's older. So that may have led to a misdiagnosis, but not because she didn't disclose, but because she didn't have the appropriate memories. So sometimes we lack the memories that we need in order to get that appropriate diagnosis. So keep that in mind. And then sometimes we're just not ready to disclose. I might tell my therapist that, I was abused when I was a child, but I may not be ready to tell them that I actively abuse prescription pain medication to help me cope. And without that piece of information, my mental health professional cannot provide a full picture diagnosis. So sometimes those issues come into play. And sometimes we just don't, we're not psychologists. We're not, maybe we haven't been in the mental health system before. We don't know all the jargon. We don't know all the labels. We don't know what we're supposed to tell the therapist. We don't know that A would be really important to tell them. Or B would be, they really need that to make a proper diagnosis. So sometimes it's just a matter of the wrong information being shared, the correct information not being shared, a lot of communication and miscommunication issues. And then you end up with the last one, which is the diagnosing professional's own bias or personal beliefs. And one of the examples of that is that right now, complex post-traumatic disorder is not recognized in the Diagnostic and Statistical Manual, which is the gold standardized way that those are all the diagnoses that are recognized within the mental health community, and that they're what's used to submit billing to insurance companies. And without some professionals see, because it's not in the DSM-5, that means it doesn't exist. And so they refuse to provide that diagnosis to some people. And so that's a bias, and that unfortunately lends to some people not getting the right diagnosis or getting an inappropriate diagnosis. Some of the diagnoses most often incorrectly given are borderline personality disorder, and that can be given when in fact it is complex post-traumatic stress disorder. I can remember when the psychiatrist who labeled me as borderline and then promptly fired me, and I said to him, I don't think it's borderline personality, I think it's post-traumatic stress. He said, oh, well, they're pretty much the same thing. Well, if they're the same thing,
they're not the same thing.
well, you know, and even more so, if they were, why would he give me the one that left me
with no hope?
Yeah. So that one, yeah, that one took me a while to get over. Borderline personality disorder is often a misdiagnosis that I see, and then attention deficit disorder / attention deficit hyperactivity disorder. So if a diagnosing professional is not trauma informed or does not have a client's full history, they can often mistake clusters of symptoms as indicating an inappropriate diagnosis. For example, a traumatic childhood impairs executive functioning in a way that often mimics ADD, ADHD. A damage to our polyvagal system, our hypothalamus, and our prefrontal cortex can result in symptoms that often look like bipolar disorder. Complex post-traumatic disorder can look like borderline personality disorder to a professional who's unfamiliar with trauma's effect on biology and behavior. And one of our community members, Jack, mentioned this morning in chat that there is a bit of a gender bias here, that more often women are misdiagnosed with borderline personality disorder, and men are more often misdiagnosed as being ADD or ADHD. So those are the ones that we see most often misdiagnosed. If you're sitting out there, you're listening to this, you're listening to us live, or you're watching this on a replay and you have one of these diagnoses, does that mean you need to, get angry, jump up, and, call your provider on the phone and demand an explanation? No. Does that mean that you need to do a little more education of yourself and look into, we're going to talk about strategies and tips here in a minute? Absolutely. Absolutely, you should, because you deserve the proper diagnosis so that the help you receive is appropriate for what you're struggling with. Okay? So if you have been misdiagnosed or you feel you have been misdiagnosed, use these tips and strategies to address your concerns. And the first one is to get a second opinion. That's your right. I realize that some people, a second opinion is not covered by their insurance, or it's not available to them. I don't know how second opinions work in places that have, centralized national health care like Canada or the UK, but I know that second opinions are not always an option, either financially or within the system that you have to work in. And that breaks my heart. But if you have the option to get a second opinion, do so. Absolutely do so. And go to see them and give them a fresh set of eyes. Don't hand over to them the diagnosis information that you've already been given. Let them start fresh. Check to see if the person diagnosing you is trauma informed. Okay? And the way to do that is not to ask, are you trauma informed? That can certainly be an initial question. But after that, then you need to ask some questions such like, are you familiar with complex post-traumatic disorder? Are you familiar with how trauma affects the brain and development of a child? Okay. Are you familiar with ways that trauma can be addressed in treatment? Ask the questions. It's also not inappropriate to ask them where they received their trauma care training. None of that is inappropriate to ask a medical professional. And if they balk at that, to me, that's a pretty good indication that they're not a good fit for you if you have the option to choose someone else. Make sure that the person diagnosing you has had access to all of the records of your prior care. Now, I just told you an instance where I don't think that would be appropriate, but more often than not, when you're going to a new provider, I do advocate that you bring with you all of your prior records so they have a complete access to your history. And I do advocate, as hard as it may be for you to do so, that you fully disclose with them all the challenges that you're having. Ask an advocate to contact the diagnosing professional and intervene on your behalf. Okay, if you have someone that you can go, that can either go with you to an appointment, or if they have someone that can advocate on your behalf, given that you have signed a release for the professional to talk to them, I would absolutely recommend this. When my psychiatrist fired me and labeled me as borderline, my therapist called him on my behalf, and we went in for a meeting with him. She went with me, and she sat with me, with him, to try and convince him that what I had done was not inappropriate and borderline was not the appropriate diagnosis. That meant the world to me. He didn't change his mind, but the fact that she stood up for me in the face of this man who had become very unpleasant spoke volumes to me, and it gave me the hope and the energy to go out and find a psychiatrist who would have an open mind and who was trauma informed. Okay, so just a general note here at the bottom. Again, we've said it a couple of times, and we'll just say it again. This information is provided for your education. We're not medical professionals, and we do not know the specifics of any diagnosis you may have been given. Please consult the physician of your choosing or the mental health professional of your choosing to discuss any concerns you have about a diagnosis you may have been given. Okay. There we go, Ms. Athena. How are things going?
Oh, it's going good. August had a question a little bit ago. She said, I'm paraphrasing,
Okay.
but she said that she's having trouble discussing with her therapist all that's going on with her, because when she gets in there, she just dissociates or shuts down. And do I have a recommendation? And I recommended that she craft a letter ahead of time and bring it with her. And then someone else said, it might have been Dominique, that said, or Kalisha, I've done that, I've written it, and then, or maybe it was Jen, I can't remember, but maybe, yes, I've done that, I've written it, walk in and I hand over the letter, just so they can actually have information that they need. Right. If we're not able, if we're dissociating or we're traumatized by even being there and we're having a hard time. I know that one of our community members recently said, I have a hard time talking in general, let alone talking about my abuse. I don't know how I'm gonna get the help I need. I don't know if I can do this. And it's just heartbreaking, because that is common among our community. It's common that, you know, oftentimes our grooming, first of all, causes us to want to stay silent.
Right.
And then when we speak up, if there's gaslighting involved, then that causes us to doubt our sanity or the validity of what it is that happened. And if you add on top of that someone who happens to be more of an introverted personality type, then of course you're going to have terror surrounding the thought of going to receive any type of care. So I just want to encourage you guys that do whatever you can to set yourself up for success ahead of time, such as, like we were mentioning, to like write a letter ahead of time before you go, or have an advocate go with you. Have someone go with. It doesn't have to be a professional advocate.
No.
It needs to be someone you trust.
Right.
Who do you trust? You know, could it be one of your friends that you've confided in? Could it be just someone that you trust to go with you, and you know that they have your best interest in mind? Like, for instance, if Bobby and I lived near one another and I was afraid to go to the doctor or had some issues with going, I would ask Bobby to go with me because I know that she would have my back.
Yeah.
And, you know, and like when Bobby had medical procedures, even just recently, like I was planning on flying there to be that advocate and be like, no,
Yes.
excuse me, but no, you're not going to do that. That is not acceptable. We'll wait for someone else to come along because that's not going to be acceptable today. Thanks.
Yeah.
So having someone go with you or writing a letter ahead of time, those are two very empowering things that you can do that puts the ball in your court and will ease your mind and get you the proper amount and level of care that you deserve. It is so painful and frustrating for us to see so many of the people in our community suffering, not only because there's a stigma surrounding mental health issues, and so that keeps people away, but then once they swallow their fear and they ignore the stigma and they're like, nope, I'm pulling up my big boy, my big girl panties, and I'm gonna go for it. I'm gonna go and I'm gonna do it. And then they go and then they're re-traumatized because they aren't believed or they're shut down. Like, excuse me, I don't need to know any of your medical health history to find something wrong with you. Like, I don't want to hear any of it or whatever. Just like showing you naked pictures or being told, you know, oh, well, obviously you have a family history of mental health and schizophrenia or bipolar or whatever, so that must be what you have. And that's not always the case, you guys. They need to spend, I'm very, very leery when I hear people go meet with someone one time and they come out with a diagnosis. I'm sorry, but who gave your doctor the crystal ball? Like, you can't meet with someone for 1 hour and give them a full diagnosis. I don't think that that's possible. You have to get to know your client. Bobby, your thoughts on that?
Yeah. And, you know, I was thinking as you were talking about, who was it that said that they were afraid to talk to their therapist?
I'm just not sure. There are so many comments.
Okay.
I'm so sorry.
No, it's okay. I wanted to speak directly to them, but I want to speak to everybody. If you are seeing a trauma-informed professional, they're not going to want you to They're not going to want you to disclose your abuse history on your first visit. They're not going to want you to disclose your abuse history on a second visit. They know how traumatic that is. And the very first thing they want to do with you is to build trust between the two of you, build a therapeutic relationship, and they want to make sure that you're safe in the present time. Those are the first two concerns. If you want to talk about it, that's another thing. But it's okay to pace disclosure. It's okay to spread it out over multiple visits. It's okay not to talk about it in the first visit. And if you have a mental health professional who's trauma informed, you may even hear them say, you know what, let's not get too deeply into that today. I really want to hear more about you, who you are today, and what's going on in your life. That's called pacing. They want to hear the information. They don't want you to get overwhelmed. They don't want you to leave that first visit and not feel well. Someone else made the comment that they're dissociating during their visits. And if you are dissociating during your visits, that is definitely something you need to let your therapist know. I'm hoping that they're aware of that they can see that happen. But if they aren't, you really need to let your therapist know that, because it is their job to help you stay present and grounded. Because there's no reason for you to go therapy and sit there and pay for that if you're dissociated through the whole thing. That's an indicator that there's a disconnect going on. So what?
Someone had a question. What would we recommend if they're having difficulty? I can't find it now because there's so many tweets. I'm sorry, guys. My executive functioning is kicking my butt today. But they're having trouble getting proper care because of their either where it is that they live or their religious affiliation, and what would we recommend? And my only question and recommendation was, are you able to get a second opinion or get different care? I don't know what else I would recommend in that case. What about you, Bobby?
Yeah, that's a hard one. But you know what? Mental health professionals are jumping online more and more, offering services via Skype and sometimes via telephone. I realize that that's a limitation for some people in terms of payment, because most of the people who are going to offer you services via Skype don't accept insurance, because insurance hasn't yet really caught up to Skype being an acceptable way to provide therapy. And that's just hard. That is so hard. We have so many community members who are in isolated communities where there are simply not very many options for services. Or they're, locked into having to go to this particular clinic because of where they live and because of their national health care system. And if they want to see someone else, then guess what? They have to private pay. So we are talking about, in a perfect world, you're going to get a second opinion. In a perfect world, you're going to say to a doctor who treats you badly, yeah, no, this isn't happening. I'm going to take my services somewhere else. But we're not at all ignorant of the reality that some of you don't have those options. So, looking at things online, looking at support groups, self-care, educating yourself through self-help, through watching our videos, through joining one of our support groups on Facebook, interacting with your peers there, and getting what you can from those connections. I wish there were a lot more options, but unfortunately that is one of the pieces of our mental health care system that is broken, and that is easily accessible, quality mental health care. Okay, easily accessible and quality, both of those things are not uniformly available in our mental health system, either here or in some other countries. And it's heartbreaking, especially for those of us whose lives depend on getting appropriate care. Childhood abuse can be terminal. There are times that when we don't get the right help and we don't get the hope, that survivors can make choices that end their lives. So it's critically important that we get the right care. I just wish I could tell you there was an easy way for all of that to happen for each of you. But right now there's not. So, Athena, any more questions, or should I go to putting up contact information?
I am.
I know things are going quickly.
It's just moving really, really, really fast. My therapist is aware of my dissociation, but not my medical doctor for procedures. August, I would definitely pull the nurse aside that takes your weight and your blood pressure and let them know that you need to speak with someone before the doctor comes. And you need to let them know of your mental health diagnoses, or let them know about your dissociation, so that someone can be in the room with you, with the doctor, and and engaging with you and checking in with you. That is the only way to not dissociate, especially if you dissociate when doctors are around, which I do as well. So, is there, I mean, I would highly recommend that you, you speak with the nurse before you go into the room. Bobby, what are your thoughts on that?
I would. And I would also recommend bringing someone with you, because in that instance, when you're dissociating, not only can you not speak up for yourself, but you're going to miss a lot of what the doctor says. So I would definitely advise you to take someone with you, a safe support person who can accompany you back to the room and stay with you through the whole thing, help you to feel grounded, help you to feel present, and take notes, perhaps, if you're too anxious to do so, and help you to ask questions, and then help you to leave and feel okay, feel grounded. I had a biopsy of a lump in my breast back in February. And I had the worst experience of my life medically having that biopsy done. The providers were not trauma informed, and furthermore, they didn't care to be trauma informed. And if I had known what was going to be involved, I was not given the full information. I was frankly lied to. If I had known what it involved, if I had known there was going to be, things blown onto my face and hair, and I would have brought someone with me. But I didn't. And so all I could do was hold myself together and go out and sit in my car and just sob for about 20 minutes because it was so traumatic. And no one gave me the information I needed to be prepared. No one talked to me during the procedure to ask me if I was okay. Furthermore, I got the impression they didn't really care. And then it was a pat on the shoulder and out you go. So yeah, our medical community does not do a good job, especially at things that they should know better. If you're doing a breast biopsy on someone who is a survivor of childhood sexual abuse, that should be ringing some bells, that person may need a little extra care, time, and attention. So I'm a big advocate of taking someone with you, even sometimes when you're not quite sure whether you'll need them. So, yeah, it happens, and it's awful, and I hate that people go through that on a daily basis, simply by oversight. Something that could be so simple as having asked me on my intake whether I was a survivor of any kind of sexual assault. It was that simple of a question, but it wasn't seen as necessary or important. So, and my mental health was not seen as a necessary or important part of me to care for during that procedure. So, oy vey, not doing that again.
No, they missed the boat. They missed the boat completely. It was very minimizing and traumatizing.
Traumatizing, yes.
It was, that was heartbreaking. I was so angry. And yeah, we need to get back on that topic at some point, Bobby, and find out when we can move the ball forward with you in that area, whenever we can talk about that.
Yeah. See, and that's the thing, is it has left me reluctant to move forward.
Yeah, and
you have kind of medical care.
Well, and you have things that need to be addressed. And
but now I'm like, oh, heck no.
yeah.
So,
you guys, we're really grateful that that you have been here with us during this live stream to discuss common misdiagnoses of adult survivors of childhood sexual abuse. And in a roundabout way, we've answered all of your questions regarding healthcare in general and what we can do. I see tonight's conversation as a conversation on what we can do to mitigate the pain and the trauma when seeking care, and how can we set ourselves up for success when going to receive care so that we are not re-traumatized. More of a conversation on that level rather than even misdiagnoses, even though misdiagnoses was the topic at hand. It's interesting that it brings up so much for so many people. And interestingly, there were many people tweeting in tonight talking about diagnoses that they were tested for when they were children and were not told about by their parents. Like nothing was ever done about it, or it was never talked about again. And then here they are, adults who have survived childhood sexual abuse, and they were tested for different things when they were younger, and then it was never addressed. It was sort of just shoved under the rug for 20 years. There are a few people in our community that were tweeting about that tonight. And I just want to encourage each of you who were tweeting about that, about not getting your diagnosis or not getting the proper care or not having that discussed with you by your parents. My son was in, his kindergarten teacher was horrible. She got some teacher of the year award like 3 or 4 years later, and I was definitely astonished. But she had a parent-teacher conference with me telling me that he was just a bad seed. Like something was really wrong with him because he wouldn't sit Indian style. He had a hard time sitting Indian style. And so she said that he was a bad seed and that he was a bad influence on other kids. Well, his first and second grade teacher said that he was a dream. He was amazing. And she actually got him tested for ADD or ADHD, and they tested him second grade or first grade or second grade, and then recommended that he go to the doctor. I took him to Kaiser and got him tested, and they had him on a very low dosage of Adderall for a while, and we called it his secret weapon, and it helped him to focus at school. But when he was getting ready to go into middle school, he didn't want to take it anymore. He said that it made him feel weird, like he couldn't be his real self, like he didn't feel like he could have his own personality, and he was rather skinny, like he hadn't gained a lot of weight, like he wasn't always really hungry. It made him not hungry. So I decided, okay, well, if you don't want to take it anymore, then that's a good choice. We'll do that. We'll see how it goes. And he did great. I mean, he struggled with paying attention. He struggled with things, but to have taken him and had him be diagnosed, and then to never discuss it with him because I was embarrassed of some sort of diagnosis or whatever the case may be, and then didn't get him the proper care necessary because of whatever reason, like that's just inappropriate and that's negligence. So for any of you out there that were tweeting about, I'm not trying to stir your pot and anger you, but I have a righteous anger for what you've endured. And that is, your parents should have discussed this with you and gotten you the care that you deserved so that you could not struggle with concentrating or learning or reading or whatever it may be. And it just hurts my heart to think that you didn't receive the care you needed back then, and then now here you are 20 years later, 30 years later, or whatever, struggling with other things because of childhood sexual abuse. And it's almost like compounded. And I just want you to know I'm sorry. You deserved better. You deserved better. That's unjust. And you were ripped off. And I'm sorry that you endured that. And I wish that I could do something about it. I know that I'm just some girl on my computer that lives really far away from you. But anyway, I care, and so does Bobby.
Yeah. There are so many of you that we wish things had been different, you know, and there are some, you know, mental health diagnoses that if you get help early intervention is so successful. And if you got that diagnosis but then got no care, wow. You have a right to be upset about that, and you have a right to grieve that you didn't get the care that you needed.
I want to celebrate Simi for a second, because she told her doctor she needed a female OBGYN because her male one made her uncomfortable. And I just want to tell you, yes, I'm throwing confetti and glitter and celebrating you and giving you a pat on the back as per your request, because that's awesome. Communicating your needs is huge, and you get a big old high five for that, because
yes.
Communicating our needs can be terrifying because our needs were not met. I mean, one of our needs was to be safe. And by definition, if you're watching this channel, you're an adult survivor of child abuse, and your safety was compromised.
Disregarded, obliterated, annihilated.
Yes.
All of the above.
You got some comments that people love your mug, so I'm going to shut up and have you talk and show everybody your mug. Wonder Woman, my favorite superhero, Bobby Parrish.
Yes, my Wonder Woman mug. I got it off of Amazon. Amazon. And it is truly almost as big as my head. But it's just full of water, so don't worry, I'm not over caffeinating this late at night. It's just water. So, but yes, Amazon, Wonder Woman.
You're my favorite superhero. I love your mug. Thank you. Yeah, you got lots of compliments on your mug tonight. Okay. Thank you for advocating for trauma-informed care. There's a lot. I don't even know how to keep up with everybody. I'm so sorry, you guys. My brain is just hurting right now. It was a really long weekend, and
yeah. If you're watching us live, yesterday was Mother's Day, and so not always the easiest holiday. And then, of course, Father's Day comes up next month. Again, not the easiest holiday for survivors. So know that we understand and that we've been there, and sometimes we're still there. So we acknowledge that it's not always the easiest holiday to get through. So if you're having a little bit of a Mother's Day hangover, and not the alcohol kind, that's okay. Take care of yourself. Be kind to yourself. And it will get better.
Yeah, it will get better, you guys. It gets better over time. It doesn't feel like it's going to get better right now, but it will. It just will. As we learn healthier coping strategies, and as we learn to trust ourselves through healing our intuition, through congruence, and the way we do that is through establishing and maintaining healthy boundaries, our whole world changes. I had a client ask me today, I forget exactly how it is or what it is that she asked me, the words that she used. Like, how is it that I'm going to feel better about something? I forget what the words that she used now for some reason, because my brain is just, it's not good right now for some reason. But my response was, your whole world is going to change once you establish and maintain healthy boundaries. You will begin to trust yourself more. You will literally live differently. You will look at yourself differently. You will walk differently, talk differently, sit differently, feel differently, breathe differently, sleep differently. Once you establish and maintain healthy boundaries, if you come from a toxic family of origin, your entire world changes. It's as though you got a complete makeover from the inside out. Everything changes. So, yeah. Thank you for sharing intimately and transparently and vulnerably with all of us tonight. Those of you who tweeted in and hung out and talked about the topic of common misdiagnoses for adult survivors of childhood sexual abuse. We're going to bid you a very fond farewell and aloha. and invite you to come back next week, Monday, 6 p.m. Pacific, 9 p.m. Eastern. We are going to transition into the portion of our broadcast where we welcome new people who are not already plugged into an online safe group that is globally accessible for anyone in any country as long as you have an internet connection. We have safe groups set up we have female only and we have co-ed. We don't have a male only group yet. I'm sure that will come soon as we are doing our best to meet the felt needs of the male survivor community. We have a deep need to make sure that we're impacting the men out there that are doing the hard work and seeking care and looking to heal. And so yeah, we're going to shift into that portion of our broadcast where we welcome new people in and give you very easy steps on how to get connected. I received several emails over the weekend, by the way, with people saying, I would like to heal in safe community. If there's any way, if we don't get a chance to respond to you right away because we have so many email correspondence, if you could go to the About section of our YouTube channel and follow the 4 steps, you will easily get welcomed into safe community, and we would absolutely love to have you. So thank you for joining us this week, you guys. If you're a normal, regular member of our YouTube community and Twitter community and just online awesome community of survivors, thank you for being here, and we're going to welcome new people now. Aloha, everybody.
Okay, let's present some contact information. All right. If you would like to connect or contact with Athena and I, or Athena or I, this is how you can do so. My email is bobbylparish@gmail.com. Athena is Athena Moberg speaking @gmail.com. And our joint email account is nomoreshameproject@gmail.com. Let me scroll up here a little bit. At Twitter, I'm Bobby L. Parrish. Athena is Athena Moberg. And the Trauma Recovery University is Trauma Recovery U. Capitals don't matter on Twitter. If you would like to connect with us on Facebook, we have our Trauma Recovery University page. And then there is the URL for my professional page. And then my personal account. I would love to be your friend. Please don't hesitate. Send me a friend request. And I know that Athena feels the same way, so friend us. Athena's professional page is Athena Moberg speaking, and her personal Facebook page is Dawn Athena Moberg. Wow, tongue, brain not working together. You can access all of our replays on YouTube, Roku TV, Google+. Just do a search for Trauma Recovery University. You can join us every Monday night or see the videos 24/7, 365 at bit.ly/Trauma Recovery U, and with bit.ly capitals do matter, because bit.ly needs so many URLs that they make capitals matter. Okay, let's share how to join us in Safe Community. All of these ways to interact with us in Safe Community are free. They will always be free. And I'm not getting to where I want to go. There we go. Okay, so ways to join our safe community. You can either join our Twitter community or our Facebook community, or both. We have 3 Twitter chats every week. Athena mentioned this earlier. The first one is Monday at 10 a.m. Pacific time, 6 p.m. in the UK. That hashtag is CSAQT, which stands for Child Sexual Abuse Question Time. And then if you're watching us live, you're currently right now involved in the second Twitter chat of the week, which is an interactive video and Twitter chat. The hashtag is No More Shame, and it is at 6 p.m. Pacific, 9 Eastern, and Tuesday at 2 o'clock in the morning in the UK. Then on Tuesday night, we have our sex abuse chat, Twitter chat, and that is the hashtag sex abuse chat. It is at 6 p.m. Pacific, 9 o'clock Eastern, and it is Wednesday at 2 o'clock in the morning for those who are in the UK. And over here on the left hand of the page, you'll see join us every week for questions and answers, bit.ly/trauma recovery U, Monday at 6, 9 Eastern, Tuesday at 2 o'clock in the morning for our UK friends. If you would like to join one of our Facebook support groups, they're completely secret and private. You can't even do a search for them and find them. This is the 4-step process, and we truly, truly, truly beg you to use this process because any other way, it is very difficult. So this is by far the best way to do it, and if you follow this process, I promise you it will be smooth. So the first thing you need to do is like the Trauma Recovery University Facebook page, and then send friend requests to both Athena and myself. Send friend requests to both of us because we're in 2 different time zones, very, very distant from each other. I think there's a 6-hour difference between the 2 of us, and our schedules are so different. So one of us might have the chance to respond to you before the other. And then once we have accepted your friend request, send us a message saying, I'd like to heal in safe community, or I'd like to join one of your support groups. Don't send the message before we accept your friend request, because messages from people who are not friends end up in our notorious other folder, where we don't get notifications that they've arrived, and they just seem to fall into a black hole. So after we have accepted your friend request, send us a message, and then we will ask you some questions about your trauma history if we do not know you from our Twitter community or a live event. And that is to protect the safety of our members in the support group so that we don't allow any predators into the support group. And then, so once we've had a chance to talk with you, we will put you in the support group that is the best fit for you, and we will welcome you into the group. We will introduce you to everyone. So that's it. That's all she wrote.
Thank you, Bobby.
You're welcome.
We had everybody that was, many of the people that were with us, not everybody, we still have some people here. They all said good night, and such an awesome group of supportive people. So if you're still watching and you just found out how to get plugged into Safe Community, we encourage you to follow those steps exactly. If you send us, like Bobby was just saying, if you send us a private message before you send us a friend request and we accept your friend request, and it goes into some weird other folder, and then we don't get notification of your message, and it just sits there for a really long time and we don't even know it's there. There's not even a way for us to know that it's there. I don't even know how to access that folder, actually. So we encourage you to just reach out and follow the directions exactly that way, so that we have a smooth transition and welcoming you into a safe community of other survivors, so you can heal in safety and receive the love and the kindness that you deserve. Bobby, what's our topic next week? I was trying to remember this morning.
I don't think we have chosen one yet.
I know we have some suggested topics from some of our community members, so maybe, yeah, we'll do that.
Yep,
so we'll let you guys know. We'll let you guys know what our topic is next week, probably via Twitter. We'll tweet it out. So search for the hashtag No More Shame CSAQT and Sex Abuse Chat, and please join us tomorrow, Tuesday night, every single Tuesday, 6 p.m. Pacific, 9 p.m. Eastern, using the hashtag Sex Abuse Chat with Rachel Thompson and our very own Bobby Parrish, and I'm usually there, just throwing confetti and glitter and welcoming people and saying hi. So, and providing support, but I love glitter. So we appreciate you guys, and we're grateful that you come here to be supported and to walk this healing journey through recovery from childhood abuse. It is a recovery journey. It does take a really long time. You'll often hear us talk about how we cannot unbake the cake. The abuse that we endured often happened over a long period of time, and it happened a long time ago. And it's been affecting us for many, 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 many years. And so we can't just snap our fingers or wave a magic wand and have it be a one and done and be all better. It takes some time. But if you intentionally choose to make healthy choices, get into a safe support group, involve yourself in safe community, and educate yourself on what it takes to recover from childhood abuse, we are confident that your life will improve greatly. And we've seen it happen time and time again, and we're living proof that you can recover and you can heal and you can live a life worth living, and it doesn't have to be as difficult as it's been if you've been trying to do it all alone. So we invite you to join us, and it's our honor to be here. We are grateful for you. Bobby, did you have anything you wanted to say to everybody before we say goodbye?
I just want to say thank you for being here. We're so honored that you come to spend an hour and a half of your time with us every week, and we don't take you for granted, and we appreciate you. So have a good week. We'll see you on Twitter if you're part of our Twitter community, and then we'll see you next week here again on Monday. So good night, everybody.
Yeah. Good night, everybody. Thank you so much. And please practice excellent self-care after you watch this video. The videos and the chats can be very triggering even for hours afterwards. And don't forget, you can reach out to RAINN at 1-800-656-HOPE or log on to their chat feature on their website from anywhere in the world, and that's RAINN.org. We'll see you next week, everybody. Bye-bye.